Hello everyone, welcome to my channel. Today's topic is laryngitis from medical surgical nursing. Let's get started. This laryngitis belongs to the unit ENT. Laryngitis is the condition in which there is inflammation of the voice box. This voice box is called as larynx, which is characterized by difficulty in voice production and sore throat. The voice box or larynx is located at the upper part of the neck and back part of the throat. So, swelling of that part interferes with the production and execution of sound. So, a person who is suffering from laryngitis, if tries to speak, the voice comes out in the form of whisper or squeak. This swelling can be triggered by other infections present in the airway. If these are the vocal cords, then comparatively swollen vocal cords looks like the second diagram. Etiology can be rhinitis, bronchitis, allergies. Basically, the existing infection of airway can create infection, can create this disease condition, inflammation of voice box. Similarly, allergies, throat irritation caused by medicine like asthma inhalers, fungal infections such as thrush, which is oral fungal infection, sinus disease or infection of sinus. Risk factors can be injury or heat to the throat, that is physical injury to the throat. Similarly, inhalation of chemical fumes can be other risk factors. Smoking, acid reflux backward from the stomach, this can be another risk factor. Overuse or misuse of voice, such as too much screaming, loud cheering for a long period of time, singing various kinds of notes, infant or children who cry too much. So overuse or misuse of voice can be risk factor. Clinical features can be impaired voice production. The voice comes out in the form of whisper, phlegm, that is production of mucus, dry cough, sore throat, tickling sensation in the throat, low-grade fever, hoarseness in the voice, trouble in communicating, a dry cough, a constant urge to clear the throat time and again, also swollen lymph nodes. Diagnosis of laryngitis can be done through, first of all, culture and sensitivity tests. The production which is coming out through the mouth can be tested so that nature of pathogen can be found. Else than that, endoscopy can be done. Endoscope is a tube which is inserted to the airway so that larynx can be viewed properly. This way, we can examine the site of infection. Also, if we need tissue for cytology or test, then we can obtain tissue. Next is if there is a suspicious lump or suspicious palpable nodule, then we can obtain the tissue through the diagnostic test, through this same endoscopy. Preventive management can be drinking. Patients should avoid drinking some things like coffee, soda, and other products, other beverages, which makes the throat dry. Patients should instead drink plenty of water, normal temperature water during day to stay hydrated. Patients should stay away from active and passive form of smoking. Also, patients should not repeatedly try to clear the throat. Doing so may cause irritation inside. Also, patients should wash hands properly and often, especially around someone who is sick or infected. Medical management can be hormonal, that is corticosteroid. This helps to relax the inflamed airway. Next can be antibiotics. This antibiotics treats the infection present in the airway and thus helps in better voice production. Also, NSAIDs can be given so that pain can be relieved. Else than that, we have voice therapy, in which a therapist trains people or patient how to control the voice and reproduce the voice again. Home-based management can be staying hydrated, drinking plenty of fluids, using humidifiers in the room so that moisture can be controlled, gargling with warm salt water. The salinity of the warm salt water does not only soothe or relax the area, but also helps to reduce the swelling. Also, throat lozenges can be used. Lozenges can be cough syrups. Patient should avoid dry, smoky or dusty rooms because that can make the throat dry. Patient should also stay away from decongestants because they absorb the moisture from the surface. So if the nasal decongestants are used, the moisture of airway or upper airway will be absorbed by those decongestants. Next is patient should not whisper while talking. Patient should try to talk in a normal voice because whispering requires a greater pressure than talking. Complications can be epiglottitis and chronic dyspnea. Thank you. Next topic will be discussed in next video.